Hello, my name is Pedro and I'm a neurosurgery resident at Hospital Braga, Portugal. My poster is titled Prognostic Factors for Survival in Low-Grade Gliomas, a single-center experience. This work includes grade 2 gliomas in Hook classification. They correspond to 5% of primary brain tumors and 15% of gliomas. The peak incidence is about 35 to 45 years old. They are slow-growing infiltrative tumors that progress in tumors of the same grade or in a superior grade. These tumors will be cause of death for most patients. An early extended resection is the current standard of care. The objective of this work was to identify and understand the influence of clinical and therapeutic factors on overall survival and progression-free survival. We performed a retrospective analysis and 96 patients diagnosed between 2000 and 2016 were included. We included patients with an age superior to 18 years old and histologic diagnosis of low-grade gliomas. Patients with other tumors or with non-cerebral glioma were excluded. We performed a survival analysis using the Kaplan-Meier method, and Cox regression was used for univariate and multivariate analysis. For progression-free survival, after applying an univariate Cox regression and applying the multivariate Cox regression for the extent of resection with the gendered age, the presentation symptoms, Karnofsky performance status, the histologic diagnosis of oligodendroglioma and postoperative adjuvant therapy, we found that the subtotal resection compared with the total resection and motor sensory symptoms at presentation compared with scissors increase the risk of tumor progression. And the postoperative radiotherapy with chemotherapy or just postoperative radiotherapy decrease the risk of tumor progression. Applying the multivariate Cox regression to the initial approach with an approach of watchful waiting or surgical approach with the same factors, we found that watchful waiting compared with surgical resection initially and motor sensory symptoms compared with scissors increase the risk of tumor progression. An histologic diagnosis of oligodendroglioma compared with other diagnoses and postoperative radiotherapy, chemotherapy, or just postoperative radiotherapy decrease the risk of tumor progression. For overall survival, we applied the same multivariate Cox regression after an univariate Cox regression, and applying this multivariate Cox regression for extent of resection with these factors that were independent in the univariate regression, we found that the subtotal resection compared with a total resection at an age superior to 50 increased the risk of death. Applying the same multivariate Cox regression to the initial approach, an approach of watchful waiting or an approach with a surgical resection, we found that an age superior to 50 increased the risk of death, and the diagnosis of oligodendroglioma decreased the risk of death. So, a total tumor resection is associated with an increased survival. A watchful waiting approach is an independent prognostic factor for a decreased progression-free survival, and the codilection 1p19q gives greater sensitivity to alkylating agents chemotherapy. For conclusion, an early surgical resection as extensive as possible is associated with an improvement in long-term survival. Thank you for your attention.